Remember when you had to wait weeks for a doctor's appointment? Or drive miles just for a quick checkup? Those days are fading fast. Telehealth is changing how we access healthcare. More and more people are turning to virtual visits for their medical needs. It's convenient, it's often faster, and it can be just as effective as traditional in-person care for many conditions. But what exactly is telehealth and how does it work? Let's break it down. Telehealth is the use of technology to deliver healthcare remotely. It's like having a doctor's visit, but instead of being in the same room, you're connected through video chat, phone call, or even email. This includes consultations, follow-ups, and even remote monitoring of certain conditions. It's important to note that telehealth isn't meant to replace in-person care entirely. However, it offers a valuable alternative for many situations, making healthcare more accessible and convenient. For patients, the biggest draw of telehealth is its convenience. No more fighting traffic, taking time off work, or arranging childcare just to see your doctor. Telehealth allows you to fit medical consultations into your busy schedule without the need to leave your home. You can consult with your healthcare provider from the comfort of your own home, saving time and reducing stress. Imagine being able to discuss your health concerns while sitting on your couch, sipping your favorite tea. This is especially beneficial for people in rural areas, those with mobility issues, or elderly patients who find it challenging to travel long distances, or those who have difficulty accessing transportation. For individuals with disabilities, telehealth can be a game changer, providing them with the same level of care as those who can easily visit a clinic. Telehealth breaks down geographical barriers, bringing healthcare directly to those who need it most. Whether you live in a bustling city or a remote village, telehealth ensures that quality medical care is just a click away. The accessibility of telehealth extends beyond just computers. With the rise of smartphones and tablets, you can now have a consultation with your doctor from virtually anywhere. This means that even if you're traveling or on a business trip, you don't have to miss out on important medical advice. Healthcare providers also benefit from telehealth. It allows them to reach a wider patient base, offer flexible consultation hours, and manage their time more efficiently. This can lead to better patient outcomes and a more streamlined healthcare system. Telehealth is not limited to physical health consultations. Mental health services have also seen a significant boost. Patients can now have therapy sessions from the privacy of their own homes, which can be particularly comforting for those dealing with anxiety or depression. Follow-up appointments, routine checkups, and even some diagnostic services can be efficiently handled through telehealth platforms. This not only saves time but also reduces the burden on healthcare facilities, allowing them to focus on more critical cases. For patients with chronic conditions, telehealth offers a convenient way to manage their health. Regular check-ins with healthcare providers can be done without the need for frequent trips to the clinic, making it easier to stay on top of their health. Prescription refills and medication management can also be handled through telehealth, ensuring that patients have continuous access to their necessary treatments without interruption. Access to specialists is another significant advantage. Patients can consult with experts from different fields without the need to travel to specialized centers, making high-quality care more accessible to everyone. Telehealth also makes it easier to get a second opinion. If you're unsure about a diagnosis or treatment plan, you can quickly consult with another healthcare provider to get additional insights. In cases of urgent care, telehealth can provide immediate medical advice, helping patients decide whether they need to visit an emergency room or if their condition can be managed at home. Telehealth isn't just for treating illnesses. It can also be used for lifestyle advice such as diet and exercise consultations, helping patients lead healthier lives overall. Family consultations are another benefit. You can discuss your family's health history and get advice on preventive measures, all from the comfort of your home. Post-surgery follow-ups can also be managed through telehealth, allowing patients to recover at home while still receiving the necessary medical supervision. Telehealth platforms often provide educational resources, helping patients learn more about their conditions and how to manage them effectively. Community health programs can also be conducted via telehealth, making it easier for people to participate in health workshops and group sessions. Telehealth even allows for international consultations, giving patients access to global medical expertise without the need to travel abroad. Continuous monitoring of health conditions is another advantage. Wearable devices can track vital signs and send data to healthcare providers, ensuring timely interventions when needed. Telehealth enables personalized care, with healthcare providers able to offer tailored advice based on individual health data, making treatment plans more effective. Preventive care is also enhanced through telehealth. Regular checkups and early detection of potential health issues can lead to better long-term health outcomes. Telehealth supports a holistic approach to health, addressing not just physical ailments but also mental and emotional well-being. Collaborative care is facilitated through telehealth, allowing multiple healthcare providers to coordinate and discuss a patient's treatment plan in real time. Follow-up on test results can be done quickly and efficiently, ensuring that patients receive timely updates and necessary adjustments to their treatment plans. Remote monitoring through health apps allows for continuous tracking of health metrics, providing valuable data for both patients and healthcare providers. In emergency situations, telehealth can provide immediate consultations, helping patients make informed decisions quickly. Wellness checks can be easily conducted through telehealth, ensuring that patients maintain their health and well-being over time. Family planning consultations can also be managed through telehealth, providing convenient access to reproductive health advice and services. Nutritional advice is another area where telehealth excels, allowing patients to receive personalized diet plans and guidance from nutrition experts. Fitness consultations can be conducted through telehealth, helping patients develop and maintain effective exercise routines. Chronic pain management is another benefit, with telehealth providing ongoing support and strategies to help patients manage their pain effectively. Allergy management can also be handled through telehealth, ensuring that patients receive timely advice and treatment adjustments. Dermatology consultations are made easier with telehealth, allowing patients to discuss skin conditions and receive treatment recommendations without the need for in-person visits. Pediatric care is also enhanced, with parents able to consult with pediatricians about their child's health from the comfort of their home. Geriatric care benefits significantly, as elderly patients can receive medical advice and follow-ups without the need to travel. Immunization advice can be provided through telehealth, ensuring that patients stay up to date with their vaccinations. Sleep consultations can help patients address sleep disorders and improve their overall sleep quality. Smoking cessation programs can be conducted through telehealth, providing support and resources to help patients quit smoking. Substance abuse counseling is another critical area where telehealth can make a difference, offering support and treatment options for those struggling with addiction. Weight management consultations can help patients develop effective strategies for achieving and maintaining a healthy weight. Cardiovascular health can be monitored and managed through telehealth, providing patients with ongoing support for heart-related issues. Diabetes management is another area where telehealth excels, allowing patients to regularly check in with their healthcare providers and adjust their treatment plans as needed. Respiratory health can be effectively managed through telehealth, providing patients with timely advice and treatment options for conditions like asthma and COPD. Gastrointestinal health consultations can help patients address digestive issues and receive appropriate treatment recommendations. Reproductive health consultations can be managed through telehealth, providing patients with access to specialized care and advice. Infectious disease consultations can be conducted through telehealth, ensuring that patients receive timely advice and treatment for infections. Oncology consultations can be managed through telehealth, providing cancer patients with access to specialized care and treatment options. Genetic counseling can be conducted through telehealth, helping patients understand their genetic risks and make informed decisions about their health. Palliative care consultations can be managed through telehealth, providing support and guidance for patients and their families during difficult times. Rehabilitation services can be provided through telehealth, helping patients recover from injuries or surgeries with ongoing support and guidance. Occupational health consultations can help patients address workplace-related health issues and receive appropriate treatment and advice. Travel health consultations can provide patients with advice and vaccinations. It's not just patients who benefit from telehealth. Healthcare providers are also reaping significant rewards from this technology. Providers also see numerous advantages. Telehealth platforms streamline many administrative tasks, allowing doctors to focus more on patient care rather than paperwork. Telehealth allows doctors to reach more patients, especially in underserved communities. This is particularly beneficial for those living in rural or remote areas where access to healthcare facilities is limited. Virtual visits can also be more efficient, reducing wait times and allowing doctors to see more patients in a day. This efficiency means that patients can receive timely care without the need for long commutes or waiting in crowded clinics. This increased efficiency can lead to cost savings, which can be passed on to patients. Lower operational costs for healthcare providers can translate into more affordable care options for patients. Telehealth also allows for better management of chronic conditions, with remote monitoring tools helping patients stay on track with their treatment plans. These tools can provide real-time data to healthcare providers, enabling them to make more informed decisions about patient care. Additionally, telehealth apps and platforms are becoming more user-friendly, making it easier for both patients and providers to navigate and utilize these technologies effectively. The integration of telehealth into healthcare systems is not just a temporary solution, but a strategic move towards a more efficient and accessible healthcare future. By embracing these technologies, healthcare providers can offer better care, improve patient outcomes, and ensure that no one is left behind. Section 5. Originating sites, where the patient connects from. In the world of telehealth, the originating site is simply the location where the patient is located during the virtual visit. This could be their home, their workplace, or even a mobile clinic. The originating site plays a crucial role in determining reimbursement for telehealth services. CMS, the agency that oversees Medicare and Medicaid, has specific guidelines on what constitutes a valid originating site for reimbursement purposes. Section 6. Place of Service, POS, codes, defining the location for billing. Understanding the location for billing is crucial in the medical billing process. It ensures that the services provided are accurately documented and billed to the correct entity. Just as important as the originating site is the place of service, POS code. The POS code is a 2-digit code that identifies where the service was rendered. This code is essential for insurance companies to process claims correctly. This code tells insurance companies where the service was provided from the provider's perspective. It helps in determining the reimbursement rates and ensures that the billing is in compliance with the insurance policies. In telehealth, the POS code will usually be different from the originating site. Telehealth services have unique billing requirements, and the POS code plays a significant role in this process. For example, if a patient has a telehealth visit from their home, the originating site would be their residence. This means that the patient is receiving the service from their home, but the service provider's location is different. However, the POS code might be the doctor's office, indicating that the service was provided from that location. This distinction is important for accurate billing and reimbursement. It ensures that the healthcare provider is compensated correctly for the services rendered, regardless of where the patient is located. Accurate entry of the POS code in the medical billing software is crucial. It helps in avoiding claim denials and ensures that the billing process is smooth and efficient. Healthcare providers and billing specialists must be well versed with the different POS codes and their appropriate usage. Regular training and updates on billing codes can help in maintaining accuracy and compliance. In summary, the POS code is a vital component in the medical billing process. It not only identifies the location of the service but also ensures that the billing is accurate and compliant with insurance policies. Understanding and correctly using POS codes can significantly impact the efficiency and success of the billing process. Section 7. Common modifiers in telehealth billing. To ensure accurate billing and reimbursement for telehealth services, specific modifiers are used. These modifiers provide additional information about the service, such as the type of telehealth technology used and whether the service was synchronous, real-time, or asynchronous, store and forward. For instance, the modifier 95 is commonly used to indicate that a service was provided via synchronous telehealth. Understanding these modifiers is essential for proper billing and reimbursement. Section 8. CMS Guidelines. Ensuring proper reimbursement. CMS has established specific guidelines for telehealth services to ensure they are used appropriately and to prevent fraud and abuse. These guidelines cover a wide range of areas, including patient eligibility, types of services covered, and documentation requirements. It's essential for both providers and patients to be aware of these guidelines to avoid any issues with reimbursement. Staying up to date on CMS guidelines is crucial for navigating the ever-evolving landscape of telehealth. Section 9. Conclusion. The future of healthcare is connected. Telehealth is revolutionizing healthcare, making it more convenient, accessible, and efficient for both patients and providers. As technology continues to advance, we can expect to see even more innovative applications of telehealth in the future. From remote patient monitoring to virtual reality-assisted therapy, the possibilities are endless. Embracing telehealth means embracing a future where healthcare is more connected, personalized, and patient-centered.